Opposition spokesman on health, Dr. Maurice Guy, wants the government to ensure direct budgetary allocation for the National Health Fund, the NHF, from the central coffers to match the increased demands for drug subsidy. He's also calling for an update on the proposed National Health Insurance Scheme. Dr. Guy was making his contribution to the sectoral debate on Tuesday. Gabriel Thompson has more in this report.
Just about 700,000 Jamaicans depend on the subsidies and services provided under the National Health Fund, NHF. In his contribution to the sectoral debate on Tuesday, Dr. Guy pointed to last week's address by Health Minister Dr. Christopher Tufton about the increased burden on the NHF due to rising costs in pharmaceuticals.
Our view, Madam Speaker, is that the Ministry of Finance should ensure a direct budgetary allocation each year for the National Health Fund to ensure that increased demands on the National Health Fund are matched by increased subvention from central government coffers, and that it is not left up to the Ministry of Health to determine how much the National Health Fund gets. The history of the National Health Fund has indicated the importance of this organization.
Noting the seriousness of the matter, Dr. Guy pointed out that without the NHF, the country wouldn't be able to access good quality medication at very affordable prices.
The National Health Fund has to be preserved and maintained as one source for supporting our healthcare system. It's a national institution which has done a lot of work and will continue to do a lot of work, Madam Speaker.
Turning to the National Health Insurance Scheme, for which a green paper was tabled in 2019, Dr. Guy says there has been little update since then.
Although this green paper was tabled in 2019, we have not heard anything further 3 years down the road. It seems it has become the norm nowadays to blame everything on COVID-19. Indeed, we recognize the tremendous effort of the Minister and the Ministry of Health to adjust our systems and protocols to confront the COVID-19 pandemic. However, we cannot have essential documents and important policies left behind and blame it on COVID-19. It must be appreciated that with the development of a national health insurance scheme, the financial stresses on the National Health Fund could be reduced.
Dr. Tufton had promised that a ministry paper on sustainable financing for the healthcare system would be unveiled in the coming months, in tandem with a series of consultations as a follow-on to the Green Paper on a National Health Insurance Plan.